Welcome to Bench to Bedside, a weekly series of live conversations about recent advances in cancer, from the research bench to treatment at the patient's bedside.
That sound and the words, "you have cancer," are something 32-year-old mother of three, Elizabeth Fuller, never wanted to hear.
It was a very scary experience to just be told you have cancer.
Elizabeth was diagnosed with stage 3 invasive ductal carcinoma, breast cancer.
It affects you mentally and emotionally and physically. I mean, just every part of who you are is changed by this thing.
Fighting cancer is one thing.
Cancer feels very isolating, just in the nature of the disease.
But facing it alone during COVID was something else.
My mom and husband got to come with me back to the room and do my very, very, very first chemo treatment. And then literally the next day, they said, no visitors.
Due to strict policy at the University of Kansas Cancer Center, visitors were not allowed.
You just want to hold someone's hand. Maybe you don't even want to talk, but you just want to hold their hand and go through it with somebody. So having that taken away was really, really hard.
Elizabeth's family got creative.
I've got my IV pole and standing next to the window waving and FaceTiming, and my nurse got in on it and was waving, and it was like a together but separate party. It was very fun.
Soon, that bell had a new ring to it.
And kind of thought, well, that's a silly, kind of awkward thing. Why are we ringing bells? But then the more your side effects are really kicking in and you're feeling crummy every day, hearing that bell, all you can think is my time is coming. I'm going to get to do this thing. And you get real excited and counting down the days.
But family still wasn't allowed in.
We all went through this together. I mean, it might have been my fight, but they were with me through the whole thing.
And they made it happen.
Instead of them coming up for my bell ringing, I got to bring my bell ringing down to them.
And that ring never sounded better.
We made it. It's kind of like crossing the finish line and having the tape. This was our victory. We did it.
October is Breast Cancer Awareness Month, and there is much going on related to breast health and breast cancer care at the University of Kansas Cancer Center. We're especially excited to talk about a new cancer center offering, our Second Opinion Multidisciplinary Telehealth Clinic. Through our telehealth services, patients can get a second opinion on their breast cancer diagnosis and treatment by visiting with a team of breast cancer specialists from the comfort of their own home. We've also launched a dense breast clinic for patients who have been diagnosed with dense breast tissue, which is determined using mammography. Because it's Breast Cancer Awareness Month, it's a great time for women to schedule their annual mammography screening, particularly during the ongoing global pandemic. Mammography screening is critical for your health and extremely safe because of the precautions in place at the University of Kansas Cancer Center to prevent the spread of COVID-19. With me to talk about these important topics is Dr. Jamie Wagner, Division Chief of Breast Surgery and Surgical Oncology and Director of the Breast Cancer Program at the University of Kansas Cancer Center. Thanks for joining us for today's Bench to Bedside. Dr. Wagner, could you start off by telling us about the Second Opinion Clinic, please?
We are thrilled to be able to offer this new clinic. About 2 years ago, when we launched the Women's Cancer Center, we were able to expand our multidisciplinary practice to doing a true multidisciplinary clinic. And that was really the platform by which we have now built using telehealth. Mm-hmm. So what we are able to do is get a breast surgical oncologist, a breast medical oncologist, and a breast radiation oncologist, all three at the same time via Zoom, to provide the same level of NCI, designated cancer center type of recommendations while a patient's sitting at their in their home.
Mm-hmm. So how does that work in terms of a patient actually setting up an appointment with this clinic?
It is actually no different than any of our other in-person visits. So they can call our nurse navigation line, and they will just tell them they're interested in getting a second opinion via our telehealth multidisciplinary clinic, and we take it from there.
So you went through the list of folks. Could you just go through that again just to make sure everybody understands
Absolutely.
the expertise that's coming to the table
Yeah.
for these appointments?
And that's truly the key to these multidisciplinary clinics, is that none of the providers are general practitioners. Everybody has subspecialty training within breast, and that's what their practice focuses on. So we have breast surgical oncologists. All of these providers are fellowship trained in breast surgery. We also have medical oncologists that are dedicated and fellowship trained in breast. And we also have radiation oncologists that are dedicated to breast.
So it's really a true multidisciplinary clinic. So tell us about the process that team goes through to develop a specific care plan for an individual patient. How does that work?
Yeah, and this is actually true if you are interested in an in-person multidisciplinary visit or if you would prefer one through the telehealth modality. But all of the information is acquired that might have been obtained outside of our University of Kansas Cancer Center system. And we are able to look at imaging, pathology reports, those critical key elements for developing a plan. We look at all of those reports. We also obtain actual images, like mammograms or MRIs, ultrasounds that may be done, and we review all of those as a team. And prior to the visit, we have discussed all elements of the cancer and the best way to move forward with treatment.
Mm-hmm. So let's talk about all of the expertise that we have on the breast cancer care team, and the fact that really all of these folks are fellowshipped, trained, and what does that advanced training mean for our patients in terms of when the rubber meets the road, how does all that expertise come together and make a difference for their care?
Yeah, it's actually been very interesting. Probably over the last 5 to 10 years, there's several different articles that have shown that when providers are actually specialty trained, so they have gone to very high level places. For example, we have multiple providers within our breast team, whether it be surgeons, radiation oncologists that have trained, and some even practice at places like MD Anderson Cancer Center in Houston. Mm-hmm. And they have brought that level of expertise back here to University of Kansas Cancer Center. And so by us having that more detailed, very disease-specific training, that has been shown to have better outcomes for patients. It can oftentimes change their diagnosis. It can change sometimes the very technical aspect, especially when you're talking about things like surgery, and that correlates to patient outcomes, complications, and survival.
So obviously, COVID-19 has really forced us to look at a whole range of different issues. And one of the things that's impacted is the number of patients or the number of kind of support folks and family that can be in a room with an in-person consultation. How is this handled via telemedicine? And how would that work, for instance?
So by having that Zoom link that's provided safely through their MyChart connection with us through our electronic medical record, the patient is able to click on that. But the other great thing is for those loved ones, they also then get to participate. They actually don't even have to be at the same location. And I've had a phenomenal experience. I had one woman, and she had 6 other women between daughters and granddaughters that wanted to participate over 4 different locations.
Oh, wow.
And they all Zoomed in, and it was a fantastic discussion because not only were we able to talk clearly about her cancer diagnosis and treatment, but how could that impact the other women in the family?
Yeah. I suspect that would prompt transparency
Yes.
Across the group. Yes. Yeah. A topic in the news these days.
Yeah.
So if you're just joining us, we're here with Dr. Jamie Wagner, Director of the Division of Breast Surgical Oncology at the University of Kansas Cancer Center, to talk about breast cancer awareness and the Second Opinion Multidisciplinary Telehealth Clinic. If you have any questions, post them in the comments below, and remember to share this link with people who may benefit from our discussion. Please use the hashtag #BenchToBedside. So Dr. Wagner, tell us a little bit about how the Second Opinion Multidisciplinary Clinic came about and why you feel that it is so important that we provide this service to our patients.
We developed this about 2 years ago at our Indian Creek campus when we launched the Women's Cancer Center on that site. And it provided us an opportunity to take that multidisciplinary care to another level. So we already had patients seeing all of those providers we've been talking about, but it might be on different days or different locations within our campuses. Mm-hmm. So now we're all one place, same time, and we're there for the patient. we are very passionate that breast cancer care should be very patient-centric, and that's what we can provide. So the patient is able to come through. Our fellowship-trained radiologist in breast will have evaluated their images. Anything that might be missing to make a final surgical decision is done that same day. The patient is provided a clinic room, and then everybody comes to them. Not only the providers, the physicians, but if you need a lab draw, we have our technicians right there, and while you're in that same room, we'll draw your blood if that's what's needed.
The whole idea of getting a second opinion when you're diagnosed with cancer is an interesting concept. Can you tell us why you think it's important for newly diagnosed patients to receive a second opinion, and why you think it's important for them not only to seek out another opinion, but to make sure that they're at an NCI-designated comprehensive cancer center or NCI-designated cancer center?
That is actually the key aspect of, I think, what the multidisciplinary second opinion provides. It's not just getting any second opinion. You want to really try and get one at an NCI-designated cancer center that has all the subspecialty training. And what it comes down to is the studies have shown it. Studies have shown that over 40% of women who get a diagnosis and a second opinion at an NCI-designated cancer center will have a change in their diagnosis, which results in a change in their treatment plan.
That's really an astounding
figure,
and I think it helps to point out why it's such an important thing for all women to seek a second opinion. And I think something else to point out is that it's not an emergency. If you're diagnosed on Monday, you don't have to have all your treatment on Tuesday.
That's right.
And figuring out the best path and the right path for your individual case, I think ultimately serves you much better, and you're going to have a much more happy with your result.
Yeah. To be honest with you, historically, I think that's how we did it. We found a cancer, and we felt like we needed to remove it surgically as quick as possible. But cancer, especially breast cancer treatment, has changed so dramatically over the last 10, 15 years. Sometimes it is actually a detriment to the patient's options and their ultimate outcome by rushing to surgery. Putting the plan together, having the right pathology, having the right imaging, and then figuring out how that plan should come together by those implementing the treatments. Sometimes surgery is actually not the thing to do first.
So another thing that COVID has impacted in terms of cancer control and care is around screening. And obviously, mammographic screening is a huge part of healthy breast care. Could you tell us why you think it's critically important for women to continue to be screened during this time?
Many of the advances that we now have and the successes that we've had in treating breast cancer is because of mammography. You can look at some studies that will show that death from breast cancer is decreased by as high as 40%, depending on the study. But what mammography and the advances of all imaging has allowed us is to identify breast cancers at smaller, early stages. And by diagnosing at that point, sometimes we need a lot less treatment to have even better outcomes for patients. And so smaller stages, earlier stages, we know patients have better survival. And that's what mammography has provided us. And, it's very hard. We're all so concerned about our health during COVID, but unfortunately, cancer doesn't stop for pandemics.
Right.
And that's what we are now providing is a very safe environment for women to continue to overall take care of their health.
So the other kind of recent development in breast health here at the KU Cancer Center has been the implementation of a dense breast clinic. Could you tell us, one, how that works, and two, why that's such an important consideration?
So women are going to very soon be getting on their mammograms, when they get that report, a reporting for what their breast density is. Okay, so prior to November of 2019, it was really at the state level, but now there is national legislation that is going to be requiring places doing screening mammography to provide women with their level of density. So what our clinic is going to provide is for women that may get that you have dense breast tissue, seek additional imaging or additional information, whatever the statement may be, that is where we will now provide a very critical service. We have specialty trained advanced practitioner providers that work side by side with the breast surgeons. Same method of getting to us, just call our nurse navigators, they take care of it. And we are going to provide basically an educational consult, because these are new words. Well, what is dense breast tissue? What does it mean? And what should I be doing with it? So we are going to provide that education. The fact that women who have dense breast tissue that maintain breast density as they've gone through menopause, those women have as much as a 4-fold increased risk of getting breast cancer. So if they're at a slightly higher risk than the average population, maybe we should be doing something more. The other aspect is that mammograms, unfortunately, their sensitivity, so their ability to pick up a cancer, is lowered with dense breast tissue. So that's almost like a second whammy for these patients. So a slightly higher risk of getting breast cancer, and then we don't pick it up as well by mammography. We have a lot of great options doing supplemental screening, meaning adding in an ultrasound to that mammogram, or possibly adding in what we call an abbreviated MRI, which is a shortened course MRI. Both of those have been shown to be extremely helpful. It doesn't mean you get out of your mammogram, which I'm sure a lot of women that don't like their breast being compressed would love, because there are still really great usefulness for mammography, but it's adding them in combination. And so we'll be able to talk about, are you one of those patients that should be thinking about this? And if so, we're going to help establish that. It also helps our providers, because this world has become very complicated, I think, for primary care doctors. And they are getting thrown so much new information all the time, and how to order all of this additional imaging is very complicated, to be honest. We have simplified it as much as we can, and it still sometimes feels complicated. So we're also helping those providers. So if they just want us to see the patient, get them set up for the right imaging, that either helps them know for the future, okay, this is what I need to order every time, or if they're just like, I'm just not comfortable ordering it, that's fine too. We will always make sure that those correct orders are in place for their patients. And then there's also the instance where women, sometimes their breast becomes non-dense over time. As we age,
Right.
that may happen. That's the other thing that our radiologists do, is we always get the mammogram first, because it's diagnosed by mammography. If their Brenzel has now started to become more fatty replaced, we'll cancel the additional imaging. We don't want them to get something they don't benefit from.
Yeah. Great. So could you tell us a little bit about what your final thoughts are on the second opinion clinic and the dense breast clinic, in terms of what that means for our patients?
These are two phenomenal opportunities, really, for patients either with breast cancer to make sure that they are getting all of the information. Education is power. And that's really what we're providing, is them to empower their own healthcare by getting education and make the best decisions for themselves. And then the other population is those that might have a slightly increased risk. And we want to make sure that, without a doubt, they are getting the very best healthcare that they can and should be getting.
Well, thank you, Dr. Wagner. It's great having you on the program this morning. And that's it for today. To learn more, please visit kucancercenter.org/women's cancer. Join us next time for Bench to Bedside. Thanks for watching.